In 1881, the sphygmomanometer was created by Dr. Nikolai Korotkov, a Russian physician. In combination with that, the stethoscope is now used today. The proper pre-assessment for taking blood pressure: make sure that the patient has rested at least 5 minutes and has had no caffeine or nicotine at least 30 minutes prior. Take the blood pressure over a bare arm. Make sure that the patient has their back supported in a chair, feet flat on the floor, and uncrossed. The arm should be elevated at heart level, and you should always remember to get the proper cuff size. Before taking a patient's blood pressure, always make sure to first find the brachial artery. You will be able to feel a pulse on the inner side of the elbow. Once you have found that, you can choose your proper cuff size for the patient. Once you have found the proper cuff size, make sure to find the artery mark on the cuff. This will be placed over the patient's brachial artery. Once you have found the proper cuff size for your patient, you will find a min and a max line on the cuff. This will either tell you if the cuff is too small or too big to fit on the patient. Make sure your patient rolls his or her sleeve up, and when applying the cuff, make sure that you move it up towards the armpit, so when putting it on, you reduce any rubbing noise with the stethoscope. Make sure the stethoscope's prongs are facing forward and not backward. Turn the valve to the right to inflate to 180 millimeters of mercury or to 20 millimeters of mercury above the first Korotkov sound. Place the bell of the stethoscope over the brachial artery. Do not place it under the cuff. When listening to sounds when taking blood pressure, your first sound will usually be your systolic. At the end, the diastolic will be your last sound. When watching the measurements, always make sure at the end that it always ends in even numbers. When listening through the stethoscope, you will hear a slight tapping sound from the blood pressure. Once you have heard the last sound, turn the valve to the left to release a rate of 2 to 5 milliliters per mercury per second. Here is a chart showing the different phases and sounds while taking blood pressure. Once done, remember to always record the patient's blood pressure. Usually there will be more than one trial. Here are charts showing the blood pressure classifications, the systolic and diastolic.